Senator from Nevada for yielding, and Senator Graham and I do have an amendment that we have filed today with respect to reforming the health care system in a real meaningful way. And it's an amendment that deals with tort reform, and it is a true loser-pays system. And we're going to talk about that in a few minutes. But before I get to that, I want to go back to some of the things that the Senator from Nevada has talked about, and I particularly appreciate his work on the mammogram issue, especially since this has been highlighted over the last couple of weeks with regard to the recommendation that has come out of the independent board that advises HHS. So I thank him for his work on that issue, and he's dead on. And all of us know that our wives are told every year when they reach a certain age that they need to have a mammogram to make sure, just like we do every year, go in and get a physical. They need to get their mammogram. And the Senator talks about those kinds of checkups providing you with the kind of preventive health care that's going to hold down health care costs. And I'm a beneficiary of that. During a routine medical examination in 2004, it was determined that I had prostate cancer, and I was very fortunate that it was picked up when it was at an early stage, and instead of having to go through a lot of expensive procedures that I might have had to go through, we were fortunate to be able to treat it. We're working on getting cured, and he's exactly right, that this is the kind of test that we need to make sure that we encourage females to get and not put barriers in front of them. You know, Medicare is such a valuable insurance policy and program that 40 million Americans today take advantage of. 1.2 million Georgians are Medicare beneficiaries. Again, I'm one of those that's a Medicare beneficiary, so this is particularly important to me. But more importantly, in addition to these 40 million Medicare beneficiaries that are in the country today, there's another 80 million baby boomers that are headed towards Medicare coverage. And we've got an independent Medicare commission that was established by Congress years ago that is required to come to Congress every year and give Congress an update on the financial solvency of the Medicare program. The purpose of that bipartisan commission is just to allow this body, along with our colleagues over in the House, the benefit of the work that they do every year in looking at the amount of revenues that come in the form of the Medicare tax and the outlays that go out in the form of payments to medical suppliers for our Medicare beneficiaries. This year, in the spring of this year, 2009, the Independent Medicare Commission reported back to Congress and said that unless real meaningful reforms are made in the Medicare system, that Medicare is going to start paying out more in benefits than it takes in tax revenues in the year 2017. Now, Mr. President, what that means is that in 2017, Medicare is going to be insolvent. And it's just a matter of time before Medicare goes totally broke. And those individuals who are baby boomers that have been paying into this program for 40 years, 50 years, whatever it may be, are all of a sudden going to reach the Medicare age where they expect to reap the benefits of the Medicare taxes that they've been paying for all these years. And guess what? Not only are benefits going to be reduced, but unless something happens, unless there is meaningful reform and it's done in the right way, there's not going to be a Medicare program. Now, I want to go back to something that the junior senator from Illinois said a few minutes ago, when he said, in talking about this issue of cuts in Medicare, that this bill that we have up for debate now that's filed by Senator Reid does not have cuts in Medicare. He could not be more incorrect. And that's not a Republican statement. It's not a statement by anybody other than the Congressional Budget Office. And I refer to a letter that's already been introduced during the course of this debate, and it's a letter dated November the 18th. And it's to the Honorable Harry Reid, the Majority Leader. And I would refer the Senator to page 10 of that letter, in which the director of the Congressional Budget Office says this, in reference to provisions affecting Medicare, Medicaid, and other programs, and I quote, "Other components of the legislation would alter spending under Medicare, Medicaid, and other federal programs. In total, CBO estimates that enacting these provisions would reduce direct spending by $491 billion over the 2010-2019 period." Then, the letter goes on this page alone to delineate 3 areas where Medicare payments, Medicare provisions are going to be reduced or cut. And I would specifically refer to them. The first is a fee-for-service sector. And this is other than physician services. It's going to be reduced by $192 billion over 10 years. In the Medicare Advantage program, a program that literally thousands and thousands of Georgians take advantage of today and millions of Americans take advantage of, is going to be reduced by $118 billion over 10 years, over the period 2010 to 2019. Medicaid and Medicare payments to hospitals, what we call disproportionate share payments or DSH payments, are going to be reduced or cut by $43 billion over 10 years. Well, what does a reduction in these benefits mean to each individual community or each individual state? I can tell you what it means to the local hospital in the rural area of Georgia where I live. The reduction in DSH payments are going to amount to a reduction in income at Colquitt Regional Medical Center in Moultrie, Georgia by $16.8 million over a 10-year period. These reductions or these cuts in Medicare are going to result in a reduction in payments to Emory Hospital in Atlanta in the amount of $367 million over a 10-year period. So anybody who says that these aren't cuts in Medicare spending simply has not read the bill and certainly has not read the letter from the director of the Congressional Budget Office to Senator Reid dated November the 18th, 2009. Now I want to turn this over to my colleague from South Carolina after this final statement with reference to reductions in Medicare spending. There's a specific reduction of $8 billion in this bill over a 10-year period in hospice benefits. Again, we've heard a number of personal stories around here, and I have a particular personal story myself. My father-in-law died when he was 99 years old. It was 3 years ago. The last 2 years of his life, he lived in an assisted living home, and he had hospice to come in 2 or 3, 4 days a week, whatever he needed. Had he not had the benefit of hospice, he would have had to go in a hospital and no telling how much in the way of Medicare medical expenses he would have incurred. But thank goodness we had hospice available, and he spent 2 days in the hospital. Otherwise, he was able to live in his assisted living home, have my wife go by and spend quality time with him, which she will tell you today are the best 2 to 3 years of her life as far as her relationship with the Father was concerned, because she had hospice there to take care of him. And here we're talking about reducing a benefit by $8 billion that saved no telling how many thousands of dollars in the case of my family. And you multiply that across America, and it's pretty easy to see that we don't need to be reducing a benefit that's going to save us money in the long run. And I'd like to turn it over to my friend from South Carolina, who also has some comments regarding Medicare, and then we'll talk about our loser pays bill.
I'd like to